The eyes are very important organs in the human body. They are essential and very prominent in the action of perceiving one's environment. Try to imagine what life would be like without your sight. Your daily routine would change drastically. Not only would simple tasks like making food or writing be significantly more difficult, but the eyes are important in the body's sense of balance. In order to ensure that our eyes stay healthy and functioning, it is important to schedule eye exams regularly. Your eye doctor can detect early signs of serious health problems such as diabetes, high blood pressure, and risk of stroke, based on the appearance of the delicate blood vessels and other structures within the eye. Hello, I'm Dr. St. Clair, and I'm an optician. The cover-uncover test. The cover-uncover test is used to determine if there is a heterotropia, or abnormal alignment of the eyes, and strabismus. How it works. The first eye is covered for approximately 1 to 2 seconds. As this eye is covered, the uncovered eye is observed for any shift in fixation. The occluder is then removed, and any refixation movements are then noted under binocular conditions. This is then repeated to the other eye. The uncovered part of the test is the same as the covered part, except the focus is moved to the eye that is uncovered. What the results say. If the uncovered eye does not show a fixation shift as the occluder is placed, but as the occluder is pulled away, the uncovered eye shows a refixation movement once binocular conditions are restored. This represents aphoria. The cover-uncover test. The cover-uncover test is used to determine if there is a heterotropia, or abnormal alignment of the eyes, and strabismus. How it works. The first eye is covered for approximately 1 to 2 seconds. As this eye is covered, the uncovered eye is observed for any shift in fixation. The occluder is then removed, and any refixation movements are then noted under binocular conditions. This is then repeated to the other eye. The uncovered part of the test is the same as the covered part, except the focus is moved to the eye that is uncovered. What the results say. If the uncovered eye does not show a fixation shift as the occluder is placed, but as the occluder is pulled away, the covered eye shows a refixation movement once binocular conditions are restored. This represents a
And this is eye exam with Dr. Daddy. So right here is one of my patients. His name is Timmy, and a couple weeks back he had reported to me that he had been having trouble focusing on things, and it seemed like his eyes been going in different directions, and his depth perception was becoming weaker and weaker. When he visited his optician, she said that she couldn't do much about it, so that's why he got sent to me, and which I performed many vision tests to help diagnose or see what the problem was, and I found out that he had amblyopia, commonly known as lazy eye. And so what I did to help fix that is that I prescribed him some glasses to help focus that so the eyes can focus together, and if the glasses doesn't work or if his symptoms become more bad, if his symptoms get worse, he should go see the ophthalmologist to see if he needs surgery. Slit lamp exam is usually performed during eye checkups. What it does is it looks for any disease in the anterior portion of the eye. First off, the doctor will place an instrument in front of your chin, which will rest on your chin and your forehead. The doctor will then put eye drops in your eye, which, by the way, is not dangerous at all. All it does is it makes the surface of your cornea more visible. And then the doctor may add additional drops so it can dilate your pupils. After that, the doctor will use a low-power microscope along with the slit lamp, which is a high-intensity light. They will look closely at your eyes in different filters to get different views of the eyes. The doctor will first examine the first area of your eyes and then perform the exam again to look at the back of your eyes. The second test we'll be learning today on eye exams with Dr. Dowdy is the visual field exam. It's a subjective measure of the central and peripheral vision or the sight vision. How it works is that you will sit and look into a dome-shaped instrument. The doctor will then instruct you to look at the objects in the middle of the dome throughout the test. There will be small flashes in the dome. When you see these flashes of light, you will press a button, and the computer program will provide the doctor with the map of your visual field. The results will usually tell the doctor to diagnose or determine the severity of or monitor the glaucoma. It can also help determine other problems like brain tumors and multiple sclerosis.
Hello there, my name is Dr. Garcia. I am an ophthalmologist. I got my bachelor's and doctorate degree from UCSF School of Medicine. And then I went on to my 3 to 8 year internship and residency at the local hospital across the street from my school. When I was around 26, I took the board exam. Since passing my board exam, I have dedicated my life to treating my patients, doing surgical procedures on them. I make sure that when I talk to my patients, I tell them all the risks that come with the surgery. I make them feel like they're going to be safe and like this is going to work out for them. And I make sure when I go into the operating room to operate on anyone that I know what I'm doing. As an ophthalmologist, I have to make sure my patients feel comfortable with me being their surgeon. And I have to feel comfortable that this surgery will go okay. Last week, I had to help one of my younger patients. She is around 12 years old. She has cataracts in her left eye. She was very scared and jittery about her procedure, but I tried to explain to her that it was a simple surgery, that she would be under anesthetics the entire time. She would not be awake at all. She might see flashes of light and movements, but she would not be awake or feel any pain. And in the end, I would just make some small incisions on her eye and take the lens out and clear them of the cataracts, then put it back in, and then let the eye heal itself without making any stitches. And it would only take 15 to 30 minutes for her to recover before she would have to go back home, and then the longer process would start. The final test you would take is the color vision test. This test determines if you have any kind of color deficiency disorder. The way this test is performed is the doctor will show you a variety of multicolored dot patterns. These patterns have 2 different numbers, letters, or shapes. Depending on which one you see, it will tell if you have a color deficiency disorder and what kind. Each time the doctor shows you a card, you will write or say to them what you see. They will tell you if or what kind of color deficiency disorder you have.